Hi everyone, happy Women Wednesday. Hope you're doing well. Today we're going to be talking about breast and chest health as well as some pleasure and of course going over some topics that we talked about last week or some things that we learned together. But we're going to give it a couple minutes, let the Whitman-Walker team join and let some people get in the room. Hope everyone's enjoying the super hot weather we're experiencing and finally summer is kind of finally here. But geez, is it hot? It's very hot outside. Hello, Kita11. Thanks for joining. In the meantime, if you'd like to schedule an HIV or STI testing appointment, please call our team at 202-797-4439. We've just pinned that number in the comments, so if you'd like to schedule a free HIV testing appointment or an STI testing appointment, just give that number a call. Our team will help you schedule an appointment. We will give it a couple more minutes for folks to join. But yeah, during the COVID-19 pandemic, Whitman-Walker's Community Health Department has expanded its outreach efforts to include social media platforms. We cover various topics about HIV and STIs, sexual health practices, access to care, social determinants of health, and public health interventions. The community health team is here to educate and support you. It looks like we've got Whitman-Walker in the room. Get them on the space. Hi, Paul. Thanks for joining. I hope you're doing well. Cool. My name is Jewel, and I use she, hers pronouns, and I work to bring educational Instagram lives to this space with Whitman-Walker's Community Health Department. And today we're going to discuss breast and chest health as well as pleasure. But first, I will go over a few things from our last live together. We learned about birth control, but in the medical prevention sense. So we learned about tubal ligation and vasectomies and kind of compared and contrasted them and which one's more cost effective and which one's got a shorter recovery period and all that good stuff. So we learned that tubal ligation runs from $0 to $6,000 depending on your health insurance coverage, plus the cost of the doctor's visit. This is a procedure that people with fallopian tubes can get, and tubal ligation involves blocking, tying, or cutting the fallopian tubes. These tubes transport the egg from the ovaries to the uterus. And when the egg cannot reach the uterus, pregnancy can't happen. Tubal ligation is a permanent birth control method, and there's a very small chance that you may be able to reverse the procedure or get pregnant via in vitro fertilization afterwards, but there's no guarantee. Tubal ligation also requires surgery and a 1 to 3 week recovery time and does not completely stop your period. Important things to know. We also learned about vasectomies, and we learned that they are anywhere from $0 to $1,000. And depending on your health insurance coverage, you just have to also include the cost of the doctor's visit. For people with testicles, a vasectomy is an outpatient surgery, and that involves blocking or cutting the tubes that carry sperm from the testicles to the penis. And this keeps sperm from being added to ejaculate. So no sperm equals no pregnancy, and a vasectomy can be reversed, but it's considered a permanent birth control solution. So after vasectomy, the doctor has to verify that no sperm is able to pass through into ejaculate. And so for the first 3 months after vasectomy, you'll need to use other birth control options. Vasectomies require outpatient surgery and local anesthesia and have a recovery time of 8 to 9 days. Finally, last week, we also just went through kind of the most common questions that people ask on Google about vasectomies and the answers to those questions. So people asked, people Googled, can you still nut, ejaculate, or come if you have had vasectomy? The answer is yes. People also Googled, why should you not get a vasectomy? This would be for personal health reasons or contraceptive choices of your own. People Googled, how painful is a vasectomy? This is a procedure that you'd be numb for, so it wouldn't be very exceptionally painful. Folks also Googled, does ejaculating after a vasectomy hurt? Only the first couple of times. So it's not like monthly recurring period pain or anything. It'll be just while you're healing. And then the folks also Googled what is the average age for a vasectomy. The average age is 35. And folks finally also Googled, does sperm taste different after vasectomy? And the answer is no. So those are all things we learned last week about vasectomies and tubal ligation and ways to prevent pregnancy. So in the breast and chest health part, in the breast and chest pleasure part of the conversation, we'll just kind of talk about different breast and chest pleasure points and tips and tricks, and then get into breast and chest health as well, and preventative health options and things to look for when you're doing your own like self-exams of your chest and your breast. But first, breast, chest, and pleasure. So it's possible to achieve orgasm without ever touching your genitals. This is all due to the power of nerves and erogenous zones. Erogenous zones are sexually pleasurable to touch, and a person might derive pleasure from touching these areas themselves. But many people get the most pleasure when another person touches them. So people like often know the common erogenous zones like the nipple, but want to mention these honorable mentions as well that also all count as erogenous zones. So they include the shoulders, hips and sides, hands and wrists, elbows, skins, calves, the cheeks, the area behind the knees, the belly button, the underarms, the feet, the temple and eyes, the forearms, and the toes. Each nipple has hundreds of nerve endings, making them super sensitive to touch. And playing with your nipples can bring you a lot of pleasure as well as orgasm. Nipple orgasm is an activity capable of all genders, breast and chest. When your nipples are stimulated, they shoot off sparks in the genital sensory cortex, and this is the same area of the brain that is aroused by vaginal or frontal or clitoral stimulation. When getting started with nipple play or chest play, start with your fingers. Use a light touch to circle your breast and areola with large strokes. The areola is the pigmented or colored section outside of your nipple that's just like a circle of color. So use a light touch to circle your breast and areola with large strokes, then ease into a gentle breast massage. When you're ready, give your breast a little squeeze, and in between massaging and squeezing, trace your areola without touching your nipples, and this will help build up anticipation. You can also add other sensations like oils or lotions or ice or clamps or nipple vibrators, as they can really amp up the pleasure. You can also increase the pleasure by pinching your nipples, as a pinch will send a rush of sensation throughout your body. And the harder the pinch, the better, but play around with pressure and find out what feels best for you and your body. And you can also add a twist to that pinch. So next we've got a little bit about breast health and breast cancer. And so breast cancer really starts with cells that are beginning to grow out of control in the breast or in the chest. They form tumors, and these tumors can be benign or cancerous. This is also known as malignant or invasive. If they invade your body and your surrounding tissues and organs, or spread or metastasize to other parts of your body, it's often diagnosed by an ultrasound or mammogram. Excuse me. The BRCA gene, also known as the breast cancer gene, is the most common gene to mutate and cause breast cancer. And people, inclusive of women and men and all genders who inherit this mutated gene, are at risk or increased risk of developing breast cancer and can also pass these genes on to their children. If breast cancer runs into your family, you can meet with a genetic counselor to discuss your risk and options. By using information about the family history of cancers, the genetic counselor can recommend whether genetic testing for breast cancer is indicated or not, and if testing is recommended, which breast cancer genes should be tested. This can also inform your care and prevention plan, helping you determine when to start getting preventative health exams like mammograms and how often you should get them. So some of the symptoms to look out for when it comes to breast cancer include breast or nipple pain, nipple discharge, nipple retraction, or this means turning inward, if the nipple is turning inward, redness or scaliness or thickening of the nipple or breast skin, skin irritation, dimpling, swelling, or all swelling of all or part of the breast. So those are all things to look out for in terms of symptoms when it comes to breast cancer awareness. So we've also got breast cancer in men, for people who don't identify as women. So although they generally have it less, men have breast tissue just like women do. all people have some type of breast tissue. So again, in other words, all genders and people have some sort of breast tissue, and so people who identify as men or other genders other than women can develop breast cancer as well, just a little bit rarer. So according to the American Cancer Society, breast cancer is 70 times less common in Black men than it is in Black women, and it's 100 times less common in white men than it is in white women. That said, the breast cancer that can develop in one gender is just as serious as breast cancer that can develop in another gender. It also has the same symptoms, so everyone can follow the same monitoring instructions that we've shared and report any changes that they see to breast tissue or lumps to your doctor, and just help kickstart that healthcare journey and making sure that everything's okay with you, and just checking out anything that doesn't seem normal. You can also conduct a breast or chest self-exam. And so to conduct this exam, it's basically regularly examining your breast or your chest on your own. And this can be a super important way to help find breast cancer early. And when it's more likely to be treated successfully when you catch breast cancer early. So while no single test can detect all breast cancers early, breastcancer.org believes that performing a breast self-exam in combination with other screening methods can increase the odds of early detection. So step 1, you want to begin by looking at your breast in the mirror, and with your shoulders straight back and your arms on your hips. Here's what you want to look for. You want to see breasts that are usual in their size, their shape, and their color. Breasts that are evenly shaped without visible distortion or swelling. And if you see any of the following changes, bring them to your doctor's attention. So if you see dimpling or puckering or bulging of the skin, a nipple that has changed position, or an inverted nipple, push inward. This means it's pushed inward instead of sticking out. Or you see redness, soreness, rash, or swelling breast self-exam. Redness, soreness, rash, or swelling. Those are all things to look out for. These are things that you don't want to see. These are things to bring up to your doctor. Step 2, now you want to raise your arms and look for the same changes. Step 3, while you're at the mirror, look for any signs of fluid coming out of one or both of the nipples, and this could be watery or milky or yellow fluid or even blood. And then step 4, next you want to feel your breast while you're lying down, using your right hand to feel your left breast, and then your left hand to feel your right breast. You want to use a firm, smooth touch with the first few finger pads of your hand, and keep them flattened together, and use a circular motion about the size of a quarter, and cover the entire breast from top to bottom and side to side, from your collarbone to your abdomen, and from your armpit to your cleavage, and follow a pattern to make sure you cover the entire breast. You can begin at the nipple and move in larger and larger circles vertically in rows as if you were mowing a lawn. This up and down approach seems to work for a lot of people. So just be sure to feel all the tissue from front to back of your breast, and for skin and tissue that's just beneath, you can use light pressure. For tissue that's in the middle of your breast, use medium pressure, and you want to use firm pressure for the deep tissue in the back. And when you've reached the deep tissue, you should be able to feel down to your rib cage. Finally, step 5, feel your breast while you're standing or sitting. Many women or many people find that the easiest way to feel their breasts is when their skin is wet and slippery, so they like to do this step in the shower, and it's best to cover your entire breast using the same hand movements that we described in step 4. Thank you all for learning a little bit more about breast and chest health and pleasure, and hope you have a wonderful rest of your day and are enjoying this amazing, amazing weather. Before we go, I want to give you a few reminders about COVID-19 and the vaccines. If you've already gotten vaccinated, congratulations. You've taken a really big step to preventing yourself, your loved ones, and your community from getting sick. Multiple variants are showing all the time, and we're seeing increases in cases right now. And we know that the vaccine is not 100% effective at preventing COVID-19. It prevents people from getting really sick with COVID-19, prevents people from being hospitalized with COVID-19, prevents people from dying of COVID-19, but does not prevent people from getting COVID-19. So just be alert, wear your mask, do what is best for you for keeping yourself healthy, and thank you for getting vaccinated. If you haven't been vaccinated or looking for an appointment, Whitman-Walker Health has vaccine available. And everyone ages 5 and up are eligible to receive a vaccine. Please give us a call at 202-207-2480 to schedule an appointment. And if you're having trouble getting an appointment with us, or if we're not close enough to where you are located and you're a DC resident, please visit coronavirus.dc.gov/don't wait. or vaccinate.dc.gov and call 1-855-363-03333 to schedule an appointment or see about which vaccine opportunities are available in DC. If you're a Maryland resident, visit covidlink.maryland.gov or call 1-855-634-6829. And if you're a Virginia resident, call 1-877-829-4682 or visit vaccinate.virginia.gov. If you haven't been vaccinated and you're not looking for an appointment, please continue to follow CDC guidelines for mask wearing, quarantining, social distancing, and the like. It's very important that you continue to that you consider to get the vaccine, but also discuss COVID precautionary measures with those who are around you, and just be mindful of masks and keeping your distance, but especially when you do not know whether a person has been vaccinated or not. Thank you all so much. Please follow our Whitman-Walker family at Whitman-Walker on Facebook, Twitter, and Instagram, and you can also learn more about our services and changes to our services at whitman-walker.org. Please also keep up with our Whitman-Walker family at RealTalkDC_ and at NoFilterDC. Thanks so much and have a great rest of your day.